to Getting Grounded, the open and honest conversation about the transition of parenthood and everything that comes along with it. The joy, the chaos, the fulfillment, the challenge, the identity shifts, the relationship changes. Let's talk about it all. Hi and welcome. I'm so happy that today we have Dr. Sara Reardon, better known as the Vagina Whisperer, on today's show. She is a board-certified pelvic floor PT, author of Floored, which, by the way, I think I told you is such a fantastic title, creator of the Vhive app, a TED Talk speaker, and just all-around wealth of information on all these things that I feel like are very confusing and we don't know a lot about. So happy to have you.
Thanks for having me, Sam.
So I want to, before I jump into so many questions, I want everyone to get to know you. Tell us about Dr. Sara as a human outside of pelvic floor information.
So this is, I'll start with saying I am a pelvic floor physical therapist. I've been practicing in this space for 19 years, and I really started my Instagram account, the Vagina Whisperer, which has kind of gained me the most exposure because I was becoming a mom and I was pregnant and going through, the aches and pains of pregnancy and also seeing a pelvic floor therapist in my clinic. And I was preparing for birth, and even as a pelvic floor PT with over a decade of experience at the time, I was like, this is hard. And, I've been telling women for a decade to do your 30 minutes of cardio and strength. And I'm like, I can barely lift a fork to my mouth at the end of the day because I'm so exhausted. And I'm definitely not doing my recommended 30 minutes of exercise. So all that being said, I had incredible births and postpartum recoveries. And I really felt like everyone needed access to that information, not just lucky me who chose to be in this field. So that's how I started my Instagram account, The Vagina Whisperer. And, that takes up a ton of my time. I absolutely love what I do. But outside of that, I am a mom to two boys. They are 8 and 10 right now, and they are wild and funny and creative and love soccer. And they keep me so busy and so active. And I have a wonderful husband, and we live here in New Orleans, which is my hometown. And we're preparing for Mardi Gras season, which is hands down my favorite time of the year, where we just get creative and wild and funky and fun. And you are able to kind of put everything that is going on in the world just to the side and just have the biggest block party in the city for 2 weeks. So it's we work hard, we play hard, and I'm just really passionate about this topic, and I'm really excited to be here to support other women and moms kind of going through some of the same things that I've gone through or that many of my patients have gone through.
Yeah, I think that's such an important distinction, things that my kids are only 2.5 years old, so I feel like I'm so close to the side, pre-kids versus post-kids. And I think there's so much that you specifically related to your field or anything in that, or just being a human in general, that you see people with kids, you understand pregnancy and birth, from this outside perspective and parenthood and all of that. And then you live it and you're like, oh, this is so different. So talking about how you had 10 years of experience, but then the lived experience, sort of reshaped how you did it. So I think that's just amazing. And it's just interesting to that perspective, that how that all completely shifts. So I'm super excited to ask you all the things because you've been doing this for so long and have lived it. But quick side note, Mardi Gras, I have been once, and my husband proposed to me on one of the balcony parties that we were at. So Mardi Gras has a special place in my heart. But it's funny because, again, similar perspective, I only thought about it from an adult experience. And then when you go and you see how cute and fun it is for the kids, it's a totally different event and so sweet.
It is. I mean, I grew up here, so I had that kind of very family-friendly Mardi Gras experience. It wasn't crazy wild French Quarter Bourbon Street. So that is still the experience that my kids have. And it is family friendly. I mean, and my kids love it. And I think what I love about New Orleans, there's a lot of things I wish were different. And I lived away for 17 years and then moved back, is that we have this spirit that kind of just lets us be wild and creative and fun. And it's totally acceptable. It's not judged. It's almost like if you're not showing up with glitter and glitz and glam, well, what are you doing here? So it just lets you be free in a way that I think that we're not able to let loose in other ways. And I actually think that kind of freedom of expression and creativity and just authenticity is what has helped me in the Vagina Whisperer brand. Like, growing my social media is just kind of like showing up as you are. There's no judgment. It's just kind of the real rawness of what's happening. And it's not sugar coated or polished. Or back in the day, we used to call them Pinterest moms. And I was like, oh, that's not me at all. You kind of show up as you are, and I'm still doing that to this day, 10 years later.
Yeah, I love that. And it's rare to find that. I love that you said that, because my husband and I, when we were choosing different places to live and we are not settled, we thought about New Orleans, and I was like, both of us were like, I can't imagine raising a family there. But you're right that anywhere else you go, or at least from what I've found and what we're trying to not find, it's keeping up with something or having this sort of look or just showing up in a way that is very much also not my vibe. So I love that perspective and that thought that you're like, it's just you. It's you who you are, and everyone is accepted there. It does have that really, really special energy.
It does. And I think that that's what motherhood felt like when I started it. I mean, I remember being 1 week postpartum with my first son, and I have a twin sister who lives in Chicago. So if any Chicago listeners, they'll run into her like on the train or Starbucks and like, are you the Vagina Whisperer? She's like, no, I'm her twin. But I'm like, ask her your vagina questions. That'd be amazing. But so I remember calling her after the first week and be like, this is so hard. She's like, well, what are you doing right now? I was like, I'm making a cake for my 1-year-old my 1 week old, because I want to take a picture with this cake and the little one on it. And she was like, stop right now. Like, what are you doing? And it was just like this performative thing that I thought I had to do because that's what I saw everybody else doing. And I thought that that's what you were supposed to do. And I was kind of like putting my own needs to the side to create this image of what I thought motherhood was supposed to look like, when it really was exhausting and awful and treacherous. It's like breastfeeding was hard. My marriage was struggling. I was exhausted. I was bleeding. I was in pain. And it was like nobody was showing that side.
Yeah.
And when I started to kind of lean into that and just sharing that, so many other moms reached out and they were like, oh my gosh, yes, I feel so alone. And this is exactly what I'm experiencing. And that was like a breath of fresh air as a new mom, and still even as a mom today, and as someone living in New Orleans, where it's kind of like there isn't this, there's always communities or groups that have that kind of like keeping up with something, but it's just a little bit more laid back here, and I really love that.
Yeah. Yeah, I love all of that. And it's interesting also because what you're saying is all the point of why I'm even doing this. And yet still, like, I have a hard time because truly becoming a mom, like, there's nothing better. There's nothing more. There's nothing more fulfilling. There's nothing that matters to me anymore. And it comes with so much challenge and struggle, like more about your personal self than mothering these amazing humans that you brought into the world. But even still, I have a hard time referencing the struggle or the difficult part because I feel bad saying that, right? I feel like it means something about me as a mom, or it means something about my kids, or I don't love them as much as I do because I'm saying something not sunshine and rainbows about it, right? So I think like we've come a long way. I can't imagine 10 years ago, to your point, I don't think people were talking about this at all. And yet still there's like this stigma and this difficult like acceptance piece of just showing up completely authentic and being like, I love my kids. Nothing is better. And my life is in shambles around me.
Yeah. I mean, I hear it all the time, like two things can be true, and I think the biggest thing is when you do kind of share like, all right, I'm kind of struggling a little bit here. Every other mom listening is like, yep, me too. I feel that too. And just to have somebody acknowledge that, like you on your podcast or me saying this or on social media or whatever, it makes people feel seen. And I think that that's the thing with pelvic floor therapy and how, again, my account started to really grow is because I was talking about these issues that were so often embarrassing, just never really talked about. It could be painful sex. It could be, urinary leakage, and it could be fecal leakage, or, any of these things. And nobody was talking about them. And so we just kept them close and suffered and struggled. But yet I was seeing women in my clinic every single day with these problems. And they thought that they were the only ones. I'm like, oh no, I see 40 other women a week with these same problems. And so It just helped women start to feel seen when we started talking more about them. And I always say we want to normalize pelvic floor conversations. We don't want to normalize pelvic floor problems.
Yeah, yeah. Well, that's a perfect segue because there's so much that I could ask you and talk to you about. Like, your account is truly a wealth of knowledge in all things pelvic floor that to this point, I think I just want to start out with like what's normal and what's not, because I also think this whole area is kind of confusing and intimidating and can be embarrassing. And so much of what's happening, like, I think even medically, we're kind of told like, oh, well, you just had a baby, so you just accept that these things are happening because that's how your body is responding or something like that. And in reality, it's not necessarily normal.
Yeah.
So what's normal, what's not, versus let's start with, like you said, pain with sex. Like how
Okay, let's just go.
childbirth.
Let's get right into sex.
Yeah, let's go right in.
So I think there's two things. What I'll start with is pregnancy itself changes your pelvic floor. So whether it's causing weakness, whether it's causing tension, regardless of what method of birth you have, a vaginal birth or a C-section, your pelvic floor changes with pregnancy, and then it also changes depending on the type of birth that you have. With a vaginal birth, what we see more is we typically see more weakness-related issues. It could be urinary leakage, prolapse, urgency, difficulty holding things in, all that stuff. But you can have scar tissue at the vaginal opening where if you had a perineal tear, that can cause pain with sex. And you may have some weakness as well that can actually lead to tension. So that is, you can have weakness or tightness of your muscles with a vaginal birth. More often it's weakness, but if you have pain with sex, it's typically a tightness issue. With a C-section, you are more likely to have a tightness issue. So there's the kind of this myth of if you have a vaginal birth, it's going to quote unquote stretch out your vagina or make you loose or make things, less desirable or, pleasurable. And that's not always the case. It can happen. With a C-section, though, you face different challenges. You have this scar that can be tight or restricted, and it can lead to pain with sex. Women who have a C-section birth have a higher incidence of pain with sex than women who have a vaginal birth. And so I want to tell you that, pain with sex is never normal.
Yeah.
And I say that because if you're experiencing it, it's not like, oh, well, it's the first time. The first time it may be uncomfortable, but some of the things I tell my moms to do are like proactively use a lubricant, because you're going to have dryness. If you are lactating, breastfeeding, you don't have your period back yet, your estrogen levels are lower. And when you have lower estrogen levels, you have vaginal dryness, you have thin tissues, and that's why you don't get your period back because your estrogen levels haven't returned to their pre-pregnancy state. So just proactively use a lubricant. For the first time, I say take it slow. Don't expect like hot, steamy sex. You're really like collecting data. I'm like, tell me what positions are comfortable. Tell me if it, if it hurts with entry or with deeper insertion. I want to kind of know how things are feeling because then we can address what's really going on. Like, are you able to have an orgasm? Do you leak with an orgasm? Is it weaker? What are you feeling? And so it's really a little bit of like, how are things going versus of like, you should be good to go. And then if you are experiencing pain, I would encourage you to either, if you had a perineal tear, perhaps doing a little bit of scar tissue massage at the very bottom if it's healed. If you've had a cesarean birth, do some scar tissue massage around and on the cesarean scar once it's healed. And then doing lots of like yoga and breathing and stretching to relax the hips and the muscles because things can get kind of tight and tense down there if you're experiencing pain. And we want to think about softening and relaxing so that we can kind of ease into this process.
Amazing. Wow. Yeah, there's even that little like tidbit. There's so much of that I had no idea. And I personally, thankfully, I didn't experience pain with sex after childbirth. A friend of mine did, and it was like similarly to this, like the first time, just like kind of gritting through thinking, oh, maybe this is normal until she went to a PT and they were like, this is very much not normal. But for me, even though it wasn't painful, it was different. Like the sex during pregnancy was different, which in your head, you're like, of course, this makes sense. You can physically see that your body is changing. So, of course, internally, you're like, yeah, that it makes sense. My body would be changing. But even after, sex was fine, but it wasn't as enjoyable as it once was. And I thought that was going to be forever. And I was like, well, I guess sex is just different now. And then now we're 2.5 years later, and sex feels a little like more akin to it did before I had children. And I'm relieved, right? I'm like, oh, it feels good and normal again. And I feel like I had no idea that was even going to be a journey in those stages, like what's comfortable, what's not, what's enjoyable, what's not, because it's different.
But that anxiety of like, is this going to get better is exhausting, right? And it affects our relationships. It affects our self-esteem. It affects our sexual desire. And, we already have lower libidos postpartum, particularly within that first year because of hormonal changes and sleep deprivation and, just our body. And so to add on the layer of pain is just could also be a factor that it's like, well, that is not normal, right? And so even if it does feel different, I'd want to investigate like, well, why? Is it a weakness issue? Is it a tension issue? Is it a lubrication issue? I think part of the reason we expect things to go back to normal is because moms are expected to go back to normal after birth. There is zero support physically, mentally, to help moms transition into this new phase. And so there's this layer of grief of, I miss my old life, I miss my old body, I miss my old relationship, and I miss my freedoms. And so we're going through that, but yet we're not getting any support, especially on the physical side, to say like, hey, let's help you feel better, move better, function better, so that you can do the things that help you move further from that grief and kind of transition into this new role.
Yeah, like full acceptance, right? Like finding the support. I think we forget that this support exists, but also B, it's like finding the time and rationalizing going to it, which is something I'm going to ask you later. So I will stick with what's normal and what's not for now. But so maybe this question isn't related to PT. I have no idea, but hemorrhoids after childbirth, is that related? And
yeah, butthole stuff is totally our jam as well. So So hemorrhoids are enlarged veins or engorged veins that can surround the anal opening or be inside of the anal opening. That typically it can happen during pregnancy or postpartum for several reasons. One, kind of the laxity of our tissues increases. So we want things to stretch during pregnancy. We want our bellies to stretch. We want our abs to stretch. We want our pelvic floors to stretch. Well, a lot of our venous tissues stretch as well. That's why we get varicose veins in our legs and even our vulvas. The same thing can happen with kind of those engorged veins, which are called hemorrhoids. The other thing is straining or increased pressure from above, which happens during pregnancy, causes those veins to get engorged. So that straining could be from lifting, it could be from the weight of the baby, it could be your genetics, but it could also be straining with bowel movements. So constipation during pregnancy is very common because you have more progesterone, and progesterone slows everything down, right? It slows your colon down. And I remember being pregnant and I was like, this piece of poo coming out is literally the size of a baseball. And I was like, how am I going to do this, And I'm like, I am a pelvic floor therapist. I will figure this out. But I'm like, this is legit, And so if, that straining is happening over and over, that can lead to that increased pressure. So yes, hemorrhoids is when this happens, I typically say, especially if it's happening postpartum, I would say, or even during pregnancy, take a sitz bath with Epsom salt. You can sit in a bathtub, you put Epsom salt in it at least once a day until they start to get better, but you can do it up to 3 times a day. We don't all have that luxury at home, but it helps a lot with shrinking those veins down. You just sit in there for 20 to 30 minutes. The other thing is to minimize straining. So if you're lifting your kids, if you're lifting weights, if you're lifting something heavy, exhale with exertion. Like don't hold your breath because holding your breath puts more pressure down on that area. And then have smooth, easy bowel movements. So you may have to take a stool softener, a magnesium citrate supplement if your doc says that's okay. Get a Squatty potty, a little pooping stool to put underneath your feet, which puts you in a squatting position, and really kind of make sure that you're hydrated, lots of fiber to have soft, easy bowel movement to minimize that straining. And you can use medications like topical medications and things like that, but it's you want to treat the symptoms, but also kind of get to the root of the problem, which is likely the straining.
Interesting. Okay, well, now I'm just going to tell you completely about myself, which is whatever, but I got hemorrhoids because my son was, I was pushing him for over 4 hours, which is a whole nother story. But then, so from that, I have a hemorrhoid, and I don't have any of the issues you just mentioned. I don't have constipation. I don't do any straining. I have a squatty potty, like all the things. And it's there. Does it ever go away?
So when a hemorrhoid kind of shrinks, it becomes a skin tag, and that skin tag will stay there forever. And then if it gets engorged again, it's becomes a hemorrhoid. Like the vein will kind of go into that tissue and get blue. It's like a blueberry. And sometimes you can know if they're internal hemorrhoids. Itching is another, like anal itching is another common symptom. But sometimes it's pain with bowel movements, bleeding with bowel movements. This itching sensation, feeling like you can't clean well, like you have to kind of constantly wipe, but that skin tag will stay there.
Okay, the hard truths.
I know. Does it bother you?
I don't love it, but it's not like it's just there. It's just like I know it's there. It's like one of those things that you're like, why? Like there's two things that my body, I feel like most of my body is pretty much the same before I had kids. One of which is because I did a bunch of pelvic floor PT, but there's like my boobs just are gone. They're totally different. And I have a hemorrhoid that just is my friend now forever. And those are the two things that I'm like, can't they just go back to normal?
I know. And they don't. And I think I look back at my 20s and then my 30s and like, damn, if I could have just like appreciated and valued my body more. Because once I hit my 40s, I'm 43 now. I'm like, oh my gosh, it just gets kind of worse, or you have to work a lot harder, you know?
Yeah.
And I mean, I breastfed 2 kids until they were like driving. And so I'm like, okay, I paid the price for that, you know? Like my body is not going back. And, you know, and there's grief with that. I think that there's grief with, you know, there used to be this thing about like love your body and I can appreciate my body, but I don't love everything about it, you know? And people are like, you look great. And I'm like, well, you haven't seen me naked, you know? And so I'm like, and I feel great, but I don't always love the way that I look with my clothes off. And I'm like, that's okay. Like 2 things can be true. I can appreciate what my body has done for me. I absolutely love that I was able to have children. I am so grateful that I had like healthy births, yet I still don't love some of the outcomes. Like that's just also the case. And so I think, again, it's this pressure to be like, either get back to normal, bounce back, or feel grateful for the body that you have. But I'm like, I just, sometimes there's grief about it. And that's part of aging. That's part of life.
Yeah, you're right. I love that particular sentiment around 2 things can be true. I have and I know my friends, like they are referencing because they're having their second pregnancies and how their body was different going into pregnancy 2 versus pregnancy 1. And I have a little bit of a different perspective because like you said in your 20s, like I was really mean to myself. Like I had an eating disorder. I had such bad body dysmorphia. Like I had this terrible perspective on just specifically the way that my body looked. And I just, on my own, did a ton of healing around it because I was like, I'm tired of this. I'm tired of being so mean to myself. I don't want to pass this on to a child I ever have. And somehow I radically came around on the other side and found this like deep love and appreciation for my body before it got pregnant. And then I got pregnant and then I had 2 babies come out of me. And so now, even though those things are different, I do love my body and appreciate it. But I think it's because I was so mad at it for so long for just existing, for just being a body that, by the way, had nothing wrong with it, right? Like I was in my 20s. Nothing was wrong, you know, like I was just being mean.
No, I mean, and that's incredible because it goes to show you there's another side. And sometimes we don't know that other side until we get there. And I think that that's the hard thing about motherhood is like, you only know what you know. And you're like, will this ever get better? You know? And I remember that after my first kid, I was like, if this is what early motherhood is like, I'm like, I don't want this. Like I was like, take me back, you know? There's no going back. But at the same time, like it's the favorite thing that I have in my life. I mean, I absolutely love it. But there's this other thing of like, okay, I don't know what it looks like I don't love my body when it's naked, but I'm like, I go play soccer with my kids and they're super into it and I can like sprint the fields with them and kick the soccer balls and like keep up with them. And I love that. And one of my sons got into cross country. So we run around the neighborhood together and that's like our thing. And so there are different things that I love about what my body does for me versus how my body looks. And so it's those 2 things can be true. And I say that because it's also, I think as early moms, there's still all of this pressure. Like there's even some new research guidelines out that are like, you can exercise but for the first 4 weeks postpartum and you can run and you can lift weights. And I tend to be on the more conservative side to be like, hey, take it easy, go slow. But I think it's because I felt all of that pressure and I was like, all right, we got to take it easy. Like this is a marathon, not a sprint. And if you don't want to get back to that at 2 or 4 weeks postpartum, like that's okay. And so there's a lot of nuance to this conversation around like what you can do and what you should do. What you should do is what feels right for you. But I mean, I tried to hit the gym at like 11 days postpartum and I was like, why am I here?
Yeah.
Like, what am I doing? You know? And so I just encourage moms to not take on all of that pressure from an emotional, physical perspective. But then there's also moms who are like, if I don't run, I'm going to lose it. I need to get out of my house. I've got to get a break. So I'm like, let's go. Like, go for it. Like, it's a cost versus benefit. But I don't think that we need to kind of be like pressuring moms to get back to any sort of physical activity that they don't feel quite ready for, because it's a process. It's a journey.
Yeah, exactly. When at first you said that, I'm like, for what? There's so much time. But that's because I'm 2.5 years on the other side versus when you're immediately there, everything feels like it's going to be forever. And you have this window of like, will this ever get better? Will this ever change? And it's funny. I was just having this conversation with a really good friend of mine who just had a baby like a month and a half ago, 6 weeks ago. She probably just is having her clearance appointment, which is something else I have a question about. But we were talking about exercise and working out, and she was saying she was using, I think the Sculpt Society, they have like a postpartum version of the app. And we have a tonal at our house, which is kind of similar. And they also had a postpartum thing, which is what I did, but not like after the 6 weeks. And I remember, and I said, oh, you know what? That was kind of nice. I really liked that stage because at nothing, you could barely move. So you weren't having this mentality like, well, I have to be able to lift all these weights and I have to be able to do all these crunches. You knew that your body couldn't, so you were comfortable with going slow and doing the breathing exercises. And I was like, now I'm back in that the other side where I'm like, man, I can't do as many crunches as I used to, or like leg lifts as I used to. Like I need to work harder to get there. And I was like, I actually kind of missed that phase. And she was laughing, saying, it's funny you say that, because as I was doing it today, I was thinking like, damn, you'd never catch me just like doing a breathing exercises workout, before. But now it's like something you're like totally comfortable with. And I think that's very important for people to be comfortable with that. And so that leads me to my clearance appointment question to this end, like the working out after, because I got there and they were like, no chance for pregnancy. And I was like, I thought you had to approve me for like that. And they were like, oh no, people come to this appointment pregnant. And I was like, that is the craziest thing I've ever heard. Like, I don't want my husband within 20 feet of me with what's going on right now. Like, and so it is this pressure. Like you probably, I assume, feel like you need to show up for your husband still. You need to show up for all the other people. And maybe why I didn't feel that way is also because I'm kind of like a go, 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 constantly doing stuff. Like think I can handle and I'm capable of everything. And so I didn't think that would change immediately having my children. Like right after giving birth to them, that next day I was like up, I'm showering, walking around the room, like doing all this stuff. And then I went home a couple of days later, 4 days later, whatever. And the thing that came out of me in the toilet was, and it wasn't poop, was so large that I picked it up and sent a picture to my midwife. And I was like, is this normal? It was the size of a softball. And she was like, no, stop doing so much. Like, sit down. And so I probably was then freaked out after that. Like, it looked like a piece of the placenta, but it was just a blood clot. Like, so
that's
it's
scary.
terrifying. Yeah, and so we need to do less is the moral of the story.
It is. And I think that other cultures prioritize that first month. I mean, there's so many cultures, Asian cultures, Latin American cultures, European cultures, where that month is sacred. It's restful. It's not just caring for the baby, it's caring for the mom. But again, we don't have the luxury of time off of work or partners who can be home for us or families nearby that allow that. And so we do kind of go back into that mode, or at least feel guilty for not being able to go back in that mode. And so, but the reality of it is that we probably shouldn't. And I always say the body keeps the score, And so it's, I tell people when they go home, I'm like, if you have an increase in pain or bleeding, you need to stop, like slow down. So I'm like, if you are feeling great and then you go for like a little mini jog or run or even a longer walk, and you have an increase in pain or bleeding, you got to pause, and those are signs of like, I'm either doing too much or I need to check in with somebody.
Yeah, yeah. I know. It's really helpful to think about and know and all the things you like want to get back into and just need to slow down. Because again, it's like you said, it's a marathon, not a sprint. There's plenty of time to get back there and you will. Okay, normal or not, clotty periods after childbirth.
Common. Yes.
Okay.
It has to do with changes in your progesterone levels and your estrogen levels. So, and they're heavier. They're just, your uterus has expanded so much. You have larger surface area on the inside, and it really has to do with hormonal changes as well. It will look like a crime scene in your bathroom. Some of the things you can do are you can take, some people get on birth control, whether it's an IUD that has progesterone that will decrease it. It can be hormonal birth control that has estrogen in it. I'm less of a fan of that, but it's whatever works with somebody's kind of chemistry. So, there are remedies to help it, but it will be heavier periods after birth.
Okay. I'm not into hormones for my holistic side, but also we just don't like each other. Like my body doesn't respond great. So I'm not into that, but I do have really bad clotting. Is it just like live with it?
It's, there is a supplement that you can take called, what's it called? Is Vitex berry, and that has been known to kind of help with some of the changes. And and you can try it. I tried and I thought it worked, and then it kind of stopped working. I didn't take any hormones for 10 years after kids, and I just recently started in perimenopause taking oral progesterone just for the 5 to 7 days before my period starts, just because it was so heavy. I was like, I couldn't travel, I couldn't work. I mean, it was debilitating, and I didn't want to get an IUD. So people are like, just get an IUD. I'm like, that just doesn't feel like what I want. I can't, that's just my own personal preference. There's nothing wrong with them for other people. So I think that there are options if you have that. But I would also say trying different menstrual products, like maybe a menstrual disc or a menstrual cup that kind of has a little bit more capacity that can be helpful. And I am obsessed with period underwear. I wear it as a backup during the day and the nighttime. So that's another thing that will kind of help if you're having like a heavy flow.
Okay, noted. I was just talking to one of my friends about that because she has it, and I'm grossed out by nothing. Like, even before kids and then after kids, of course you're grossed out by nothing because you're covered in vomit and poop and whatever. But period underwear, it's weird to me. Like, I can't wrap my head around it.
You know what? Somebody else told me that too, and when you find out how helpful it can be, like for some reason, pads and liners gross me out more. So
yeah, that's fair. That's fair.
So it's kind of like you're like, pick your poison. And I'm like, I'm going to pick the lower profile one that doesn't make a crinkly sound when I sit, So that's really just my preference.
Right. Okay. I'm going to try it out. Now I've had multiple recommendations. Okay. So does pelvic floor strength come back on its own? If so, when? If not, what's the recommended see someone situation?
No, not necessarily. It's kind of like if you don't strengthen your biceps, will they just get stronger by themselves? I mean,
that
maybe with functional.
Good reference.
Right. I mean, they can with functional stuff if you're lifting babies or you're really active. So it can improve. It can improve if you were doing strengthening workouts and you've got really good pelvic floor engagement during those. But I would say if you're kind of like sitting around and not doing much, it may not come back to where it was pre-pregnancy. And when you get into your late 30s, early 40s, you start to hit perimenopause. So we're having babies later in life, which makes postpartum and then perimenopause one blurry season. And once you hit perimenopause, your estrogen levels start to decrease. So I recommend your pelvic floor muscles are functioning at less than 50% at your 6-week visit. So I recommend during that first trimester or that fourth trimester after birth, that first 12 weeks postpartum, to start doing, again, those breathing exercises, that deep core engagement, learning to kind of activate your glutes and your abs and your core to strengthen, rebuild the foundation of your house, which over 10 months and then birth has been shifted. And then bringing that into any other workouts that you do. So it could be Pilates or bar or strength training, kind of yoga. It could be just learning how to activate and engage and then also relax those pelvic floor muscles so that you get the most out of your workouts. And then also bringing them into function. Like if you're lifting Think of your luggage into an overhead bin. If you're lifting a stroller into a car, if you're carrying in bags of groceries, we want to be exhaling. Again, no holding your breath. That's that exhale with exertion so you don't have pressure down, and then engaging those muscles to kind of support you. So I have a whole kind of postpartum recovery program in my app because I think it's oftentimes what I saw with a lot of my patients is they were going back to whatever they were doing before pregnancy, which is what their doctor told them to do, without the proper training or rebuilding of their core. And so it was like, oh, well, I'm leaking and I have prolapse and I have pressure. And I'm like, well, that's because we're doing things that your body's not quite ready for. And especially when you have lower estrogen when you are lactating or breastfeeding. That's kind of an additional layer of, they call it genitourinary syndrome of lactation, where you can have dryness, urgency, leakage because of that hormonal estrogen deprivation. So you want to make sure you've got the strength to combat that.
Wow. Yeah, this is such an interesting point too about what your doctor tells you and is perfect because it's one of my next questions. I probably wouldn't have gone to a pelvic floor PT because I didn't have any of those like classic symptoms that you before associate with them, but I had a physically visible, very bad diastasis recti, or I don't even know how you say that properly.
Yep, that's right. That's exactly right, which is an abdominal separation. I think a lot of moms it's an abdominal separation where it looks like the midline of your abs is like coning or doming or kind of sinking in.
Yeah, and I had twins, so they're like, that's probably why. But I think also I maybe did things like worked out wrong while I was pregnant that maybe like exacerbated it a little bit because it was more than 4 fingers. Like it was a huge separation. And I was like, I don't know how to fix this. And I had to look it up. No doctor was like, you should probably see a pelvic floor PT before or after, but they're like, oh, have a lactation consultant, which also is incredibly important, but this was not like an immediate initial recommendation. So that's why I went. And then all of the other things that you're mentioning, I'm like, oh, that's not normal. Oh, this is, and I don't even know that I'm fully strengthened, quote unquote, back to normal in my pelvic floor because I went to just a regular gynecological exam not that long ago. And they were like, yeah, make sure you're doing your Kegels. And I was like, come again? I was like, how off? I'm like, one, why are you telling me that? Does it feel really weak? And two, what? And they were like, oh yeah, do it. Hold it this many seconds, do it when you're in the car. And then I went to do it and I was like, I can't hold it for more than 3 seconds. Like this seems like a problem. So both of those things, should we be constantly doing Kegels and how normal is it to hold it? And diastasis, how normal is that? Are there things you can do to repair or you just go to a pelvic floor PT to help repair? Because it's better now, which is great.
Good. So there's several ways to kind of access pelvic floor care now. So some of it is going in to see someone in person. Some clinics take insurance, some do not. So I think that in person, nothing replaces it. Unfortunately, a lot of us don't have access to a therapist. The waiting list can be very long. It can be expensive. We don't have childcare or time off of work. So you can do online programs like the VHive. My app has the workouts are 10 minutes. I'm like, you have 10 minutes. I made it when I was like 4 years postpartum. Like, how much time do I have? 10 minutes. I don't have 45 minutes 4 days a week. I just didn't. So I was like, but I know I can do this 10 minutes 3 times a week. And so, you can do app programs, you can do telehealth, there's YouTube videos. So I think that you want to be thoughtful about it and just have some training and guidance because, they could tell you like do Kegels when you're in the carpool lane or at the red light, but you don't need the same pelvic floor strength when you're sitting in your car as you do when you're running, jumping, doing crunches. So it's like you have to learn to use the muscles in the positions you need them to work. Squatting, lunging, picking up your kids, lifting weights, jumping. I mean, we have to train our muscles for those activities. And so, Kegels are not the only thing that's strengthening your pelvic floor. It's a pelvic floor contraction. It's like, yes, I can do bicep curls all day to strengthen my bicep, but I also want to work my delts and my lats and my pecs and the whole complex because it's not just the pelvic floor muscles, it's your entire core that needs to be rehabilitated.
Incredible. Yeah, that makes a lot of sense. And you forget that there are other resources too. I only now know about your app because I found you relatively recently, but also with what I'm saying, being 2.5, 3 years postpartum, like it doesn't just come back. So I think it's important to find and keep doing that. So I'm going to check into that. But which also leads me into my tips and tricks section. So obviously this is, there's the app, there's ways to access the workouts, but beyond that, or actually included in that too, like what are some specific recommendations that you have for people prenatally? Is there things that you can do that make birth easier? Is it possible to make tearing less common, or is that just a genetic thing? And then also like immediately postpartum.
So during pregnancy, I really am a fan of strengthening your pelvic floor proactively. Again, we're going into a life event that we know is going to change how our pelvic floor is functioning. If you have tension, you're going to want to work on relaxation, yoga, breathing, stretching. But I recommend you strengthen throughout because, again, your pelvic floor and core is changing. But that doesn't mean do a lot of crunches. It means learn how to properly engage your deep core and pelvic floor muscles and doing exercises. I mean, you can do planks and push-ups and squats and lunges and lift weights, but all when you're kind of engaging those deep core muscles to help support you and baby. And the benefits are great. They're great for you. Moms who exercise during pregnancy show better postpartum recovery, better mental health benefits, healthier baby. So the benefits are huge. Now, during the third trimester, if you're planning for a vaginal birth, I really encourage you to learn how to push. And we don't teach moms this. And, we're not even realizing we have to do it because until we're in a hospital room with our feet in stirrups and there's 10 people there and the lights are shining on us and it's a really vulnerable time.
Yeah.
And so we teach this in therapy. I go over how to do it in my app, but it's kind of like you're having a bowel movement. So you're kind of bearing down and opening up the pelvic floor muscles as if you're having a bowel movement, but you want to practice exhaling as you do it. So minimizing holding your breath. They're going to coach you to hold your breath when you are pushing, but if you can do it by like exhaling but still pushing hard, that's going to help spare your pelvic floor, especially if you have like a 4-hour birth, as you mentioned. You can push in different positions even with an epidural. So if you are pushing lying on your back and it's not progressing, I'm like, lie on your side. Like try a different position. Why are we doing the same thing for 4 hours and expecting a different result? You can even get into a hands and knees position and, try pushing in that position. And so I think that those are important things to know. And then when it comes to tearing, lying on your side, having a doctor or midwife who uses what's called a hands poised position. So they're not they're not doing any perineal massage during birth, but they are just kind of having their hands ready. And you can also have someone put a warm compress on the perineum, which is the area between the vagina and anus when you're pushing, and that can soften those tissues and also minimize the risk of tearing. I do have all of my moms do perineal massage if they're open to it, starting around 34 weeks of pregnancy, and that is just kind of a massage to the lower half of the vaginal opening that can soften the tissues and muscles. The research does not say that it prevents tearing, but it can minimize the risk of more severe tearing. So you're less likely to have what's called a 3rd or 4th degree tear with that technique. Doesn't mean you won't, it just means you're less likely to.
Yeah. Okay. Amazing. As you can imagine, I tore. And also I think with the pushing, like that, your description is exactly what happened. They were like telling me how to push and I was like, okay. And they said like, you're having a bowel movement, like as if you're trying to push it out. And I was like, I don't do that. Like my boobs are fine. Like, what do you mean? And so I don't know, maybe I did it wrong. And that's why I ended up with the hemorrhoid. Who knows?
Well, and it's hard. I mean, it's like, so even when you're pooping in that 3rd trimester, I'm like, put your feet on the stool, like you're having a bowel movement. I mean, like you're on a squatty potty. So you're in more of a squatting position and practice like exhaling and pushing out. And I even say, put a piece of toilet paper over your hand and kind of like hold your vagina and be like, or your vulva and be like, do you feel like downward motion? That's what you're looking for when you're pushing out your baby. And so practice that during your bowel movement. So it's not the first time that you've tried to do it, because after you have an epidural and you've got strong contractions with Pitocin, it's much harder to replicate that. So like practice it so it becomes more familiar versus when you're medicated and you're like, I can't even feel anything. So just different things to try that may help you feel more informed during the process.
Yeah, no, that's it. Like, yeah, practicing anything so that everything's not brand new like it will be. So that's such a good tip. Do you have tips in between pregnancies? Like, are there, because I'm sure that's one is different to the next. Like, are there things that people can do that help that or that
Yeah,
make
I mean,
any,
I always think that, so not tips and tricks, but recommendations, I would say that, if you going into your second birth, sometimes it feels a little bit like, oh, what's the point? Like, it's just going to happen again. But there's always a benefit to rehabbing, re-strengthening, working on your body to get you more prepared for that second one. I actually think moms on their second ones do more because they're like, oh, if I would have known this the first time around, this could have been different. And so I find them actually doing more to prepare, whether it's going to therapy or learning how to push or having a doula or whatever the case may be. But also know that the second pregnancy things, it feels like you're pregnant, like you visibly pregnant way sooner. Like your belly just kind of like gets, bigger faster. Your hormones change faster. Everything just feels like it happens quicker than the first one. And second births, they also are typically faster. The labors are faster. So if you had like kind of a fast birth for your first one, like that second one will likely be rapid. So I'm like, just get to wherever you're going pretty soon. Don't wait at home long time. So, but that's kind of good to know. But the other thing is a lot of the changes that are made to the pelvic floor happen during the first birth, not the second. So if you're worried about prolapse or tearing, those are typically don't necessarily get worse with a subsequent birth.
Oh, that's interesting. I assumed that like once you've gone this way, it's only gonna go down. So I didn't know that. That's uplifting.
I know, right? Like encourages us to keep growing the population.
Yeah. Okay, so we were talking about before, like who has the time and how do you balance this? Like, how does someone make the time for either seeing a PT or, I mean, well, your app is a great option because that's 10 minutes. But if you are a busy mom I know a lot of pelvic floor therapists will be like, just bring the baby. And because I had twins, I was like, that's not going to happen.
Right.
Like, I need to figure out a way, like, how do people make time for this or prioritize this? Is it just getting an app and trying to find 10 minutes, or are there other ways that you suggest prioritizing this in any way?
I think that it's a little bit of a mindset set shift because we prioritize ourselves last. If my son has to go to the doctor, I'm like, clear the schedule. If I need to like do something, like, oh, I'll do it tomorrow, or later this week, or let me just see if it gets better. So it's a little bit of a mindset shift of the value that you have and how important it is to care for yourself. And that is something that I struggle with 10 years in, and it's just my personality of knowing kind of when to step up and when to step back. And so I think but we always say like, put on your own oxygen mask before putting on your kids is because you do have to be well. Like a healthy mom, mind and body is important for the health of the family. So I think that that's one thing to just prioritize. The second thing is that if you go see a therapist in person, it's not every week for like 6 months. It's every week for maybe 4 weeks. And then they should be giving you things at home to work on, or you can do and things that fit into your schedule. So even during pregnancy, when I have moms who are like, how can I do my stretches? And I'm like, okay, when you're brushing your teeth in the morning and night, like get into a deep squat position. And like, that's where you're doing your pelvic floor stretches. When you're practicing pushing, doing while you're pooping. So it's like, you don't have to like pull out a mirror and carve out all this extra time. When you're picking your kids out of the bathtub, like pull your low abs and deep core muscles in and kind of exhale. So bringing these things into things you're already doing, and that makes them habit. And then you do what you can. You do 1 workout a week, you do 3 workouts a week, you go for a walk. It's whatever you're going to be most consistent with. If it's better for you to get out of the house to do a workout class than to be home, then that's what you do. For me, it was always better to be home because my husband traveled a lot. So I was like, I needed things to do at home that didn't require me having to leave. And so that's kind of how home stuff became more convenient and reasonable for me.
That's amazing. I think having it in your day-to-day, like those daily moments I never even considered that, but like like picking them up in the bathtub. I'm thinking about it and I'm like, yeah, my kids weigh like 35 pounds at this point. Like picking them up out of the bathtub is a great time to think about doing those engaging or like, they're still having me carry them around. So that is super, super helpful and super like an interesting reframe to think about. So I'm keeping that one for sure. Okay, so I know you mentioned the Squatty Potty a bunch of times, and I've seen that on your account. I have a Squatty Potty. I love it. But are there any other tools or things that you're like, oh, definitely have these, they're super helpful? I know I saw one of these posts that I think you didn't recommend the post-birth belly band, but I had some people recommend it to me. So I went back and forth on wearing it or not. So curious your thoughts on that and any other tools that you're like, yes, definitely use these or definitely don't.
Love that. So I'm not a fan of waist trainers, but I am a fan of compression. So particularly post C-section and post birth of multiples, having one of those abdominal wraps I think is really helpful. Or especially if you have like a really wide diastasis, really stretched out abdominal wall, it just gives you a little bit of a hug that you don't have right away. So I think that that's totally fine. I am a fan of compression where it's like covers the underwear and the belly. So it's like whether it's compression leggings, they have like briefs that go up over your waist, over your C-section scar, up to your bra. My favorite brand is called Love Steady, and they're like just kind of these like, it's almost like light Spanx, but it just kind of gives you a hug. So it gives you a little bit of support, but it's not squeezing your waist. Those really tight waist trainers that have these like thick corsets and these hook and eye closures, that doesn't give your room in your abs and your diaphragm to kind of open and breathe. And it pushes everything down towards the bottom. And the bottom of your pelvic floor, your vagina, is weak and vulnerable after birth and after pregnancy. So I don't want all of this pressure down when we're trying to lift up. So again, just compression support, but not a waist trainer or waist squeezer.
Got it. Okay, good. I didn't use a waist trainer, but I did have like a compression band, so that's good to know.
And then other things are like, I love a little tennis ball or lacrosse ball to massage the hips, a really great lubricant. There are these things called therapy wands that like look like an S, and you can like release tight trigger points in the muscles deep in the pelvic floor. There's a lot of like tips and tools that you can have at home. And I love a bidet, if you've got hemorrhoids or, just wiping issues, even heavy periods. So lots of things just to kind of make this more comfortable.
Okay. Amazing. My husband is like very into having a bidet, and I'm like, I don't know, it kind of grosses me out, but I don't know why it shouldn't, but
I love it.
Good to know. Okay, I'll let him know. Points for the bidet. Okay, last question I have is, I'm sure there's a lot of these, but are there any, like, when people come in and see you or talk to you, like, what are people most surprised to find out about pelvic floor health or things related to, it doesn't even have to be postpartum or pregnancy, like, could be perimenopause, but any of these stages, like, what are the most common, like, misnomers?
I think that they're surprised that pooping issues, hemorrhoids, constipation, fecal leakage are related to your pelvic floor. They're like, oh, I never thought about that. I'm like, oh, it's part of the pelvic floor muscle. So that's related, that sexual issues can be related, that pain with sex could be tight muscles. It could be scar tissue. It could be their C-section scar. That, we don't think of sex as like a muscular issue, but it's highly a muscular issue. And that it changes at every season of life, whether you are pregnant or postpartum or lactating or going into perimenopause and menopause. Our body requires different things at different times. So I think that's important. And another one is that, I think we still have this thought that pelvic floors are always weak. And it's not the case. So many women have pelvic floor tension that causes painful sex, vaginal and vulvar pain, painful bowel movements, incomplete bladder emptying, even leakage, straining. So it's this thing of, we don't want like super tight, strong pelvic floor muscles all the time, because it could actually mean they don't relax well. We need muscles that contract and relax, because we need these muscles to relax for sex and pooping and birth and, urination. So we need functional muscles, not just like tight vaginas. So I think those are some of the things. And then right now there's so much buzz about perimenopause and menopause. And I tell my friends, I'm like, you have to be on top of this, because once you hit perimenopause, it's like your estrogen levels fall off a cliff. And that's what helps keep your pelvic floor and vulva and vagina healthy and strong. So you need to be doing your strength training during perimenopause for your pelvic floor. So you're going in with more strength in those muscles. So when your estrogen levels change, you have, just more in the cup.
Yeah. I know it is. There's a lot of information out there lately that I think about, like, this is such a long time ago, but I think about when my mom went through it and just like how, like, as a child watching that, or like a teenager probably, like seeing that shift in perspective, and there wasn't any information. So now as like a woman in her mid 30s and seeing all this, I'm like, yeah, there's a lot, and there's a lot of hormone replacement and all these things that are kind of becoming like buzzy topics.
I think buzzy, but I think it lets people know their options. And I have so many women who want to be on hormones and so many women who don't. And I'm like, I want you to know your options, and then you make the choices that fit best for you. And so that ultimately, I think historically, there weren't even options. It was like you were just told this is the way, and then you were told this is no longer the way. Now we're being told this is the way again. And so I think I think women deserve to be able to make their own decisions about their bodies, but we need the information in order to be able to do that.
Yeah. Well, all the information you can find from Dr. Sara Reardon. So thank you so much for coming on today. This has been such an informative conversation and so enjoyable. You're so wonderful. Tell everyone where they can find you, where they can find your book, and, just what's coming next, all the things.
So I am on social media as the Vagina Whisperer. On Instagram, I'm the.vagina.whisperer, where you can find tons of information and fun videos and all the things: pregnancy, postpartum, perimenopause, peeing, pooping, everything pelvic floor. I'm on TikTok as the Vag Whisperer because TikTok doesn't like the word vagina. And then my website is thevaginawhisperer.com, where you can find out all about my VHive app, and it's totally free for 7 days. You can try it out and see what a pelvic floor workout looks like, or, if you need to do a little bit before you get into therapy, whatever the case may be. But it's there to make it accessible and hopefully affordable for people. And then my book is called Floored, A Woman's Guide to Pelvic Floor Health at Every Age and Stage, and it's available wherever you want to buy books. And it's just a really great way to kind of get an understanding about your body. It's like everything we were never taught. And you can read the whole book, or you can go to the season or the chapters that are where you are, like if you're pregnant or you're postpartum, or if you're in menopause, or all of these things. So it's I think it just really gives people kind of a little bit of a Bible about how to care for this part of their body, because we unfortunately aren't being taught consistently about it. But thank you for having me on. And I love, obviously, you can tell, talking about this. And I just really want people to feel like there's hope. It's never too late. If you're years or decades postpartum, it's never too late to get help. And I really just want to encourage moms to take action to care for their bodies, because we're worth it. And I want you to be able to run with your kids and jump on the trampoline with them and lift them from the bathtub and all the things that are part of motherhood. I don't want anyone's pelvic floor keeping them from doing that.
I love that. Yeah, you can tell you're so passionate about it and care. So thank you for taking the time. Thank you for leaving us on that note. You are so wonderful. It's a very worthwhile follow. I am definitely going to get that book. So thank you so much. You're the best.
Thanks for having me.